Hi everyone, good afternoon. So welcome to Wednesday Reading Live. This is me Vandana PS joining you from 𝐕 Academy. So in this video, we will be dealing with a sample question from part B initially, then we will discuss the answers, then we will move on to the next part A. Okay, so first of all, I'll show you the question on the screen and I'll give you 2 minutes for the question, then we will check the answer. Okay, so here comes the question. Okay, so once again, welcome back. So, have you guys done the question? Yes. So, here is the question. The guidelines inform us that personalized equipment for radiotherapy. So, when you read a question from part B, it's important you have to read the question first, then underline the keywords from the question. So, why we are underlining the keywords? Because it is to understand the question. Okay, so which are the keywords from the question? So, I can say guidelines, then personalized, then radiotherapy. So these are my 3 keywords from the question. Okay, so you don't have to mark more than 3 keywords. Then the second procedure, so understand the question. Then in which category the question falls under? Any idea? In which category the question falls under? So in part B we have 3 categories of questions, right? Yes. So in which category the question falls under? Okay, Riba, Joycey, yes, Anusuya, Reshma, good afternoon. Yes. In which category, Riba? Any idea? In which category the guideline? Yes, the question falls under. So, yes, these are guidelines, okay, which comes under the first category. So, guidelines comes under the first category. If it is a guideline, then what are you reading for in a guideline? So, which we are reading for details. So, what are guidelines? Guidelines, which means a set of rules and regulations that someone has to follow. It is compulsory. All right, yes, so very good. Okay, so what are you reading for in a guideline? Okay, sorry Riba, it's not for the purpose, it is for the details. Okay, because it in a Set of principles will be there. So definitely we are looking into the details, not the purpose. Okay. Okay. So we are reading for details. Then, which sentence is important in a guideline? Any idea? Which sentence is important? Okay, very good, Ansuya. It is first sentence is important. Of course. Okay. So I'm reading the options next. So first one is advisable for all patients. So my keywords from option A are advisable all patients. Then option B, improves precision during radiation. So my keywords improves precision, then radiation. And from option C, needs to be tested at the first consultation. So my keywords needs to be, then needs, tested, then first. So these are my keywords from these three options. Okay, so now we are reading the question. Okay, then you guys can tell me or comment which is the correct answer. Clear? Okay, so guidelines. Radiotherapy simulation planning appointment. The initial appointment may also be referred to as the simulation appointment. During this appointment, you will discuss your patient's medical history and treatment options and agree on a radiotherapy treatment plan. The first step is usually take a CT scan of the area requiring treatment. The patient will meet the radiation oncologist, their registrar and radiation therapist. A decision will be made regarding the best and most comfortable position for treatment, and this will be replicated which means copied, daily for the duration of the treatment. Depending on the area of the body to be treated, personalized equipment such as a face mask may be used to stabilize the patient's position. Then, this equipment helps keep the patient comfortable and still during the treatment and makes the treatment more accurate. So, any idea? Let me know in the comments which is the correct answer for this question. Okay, any idea which is the correct answer, Joycey? What is your answer? Let me know in the comment. The guidelines inform us that personalized equipment for radiotherapy. Okay, so when you read a question, always connect your question with each of the options, and that is important. Okay, so radiotherapy, I'm connecting with option A, is advisable for all patients. So where is it mentioned? It is advisable, it is compulsory for all patients. Okay, anywhere mentioned in the paragraph? When I read the paragraph, did you guys see anything related to this radiotherapy equipment is advisable for all patients? Okay, so we can first of all eliminate option A because it is not advisable for all patients because not mentioned anywhere in the paragraph. So I am eliminating option A because it is not mentioned. Okay, then guidelines inform us that personalized equipment for radiotherapy improves precision, accuracy, precision which means accuracy during radiation. Okay, so what about option B? Is it mentioned anywhere? Improves precision during radiation. Personalized equipment for radiotherapy improves precision during radiation. Or it is option C, needs to be tested at the first consultation. Okay, Joycey, your answer is option C, right? Okay, so where did you get that answer from? May I know? Where did you get that answer from? So option C, which means needs to be tested. What do you mean needs to be? Needs to be which means have to be. It is compulsory. Okay, have to be, needs to be tested at the first consultation. So where is it mentioned? It needs to be tested at the first consultation. Okay, so that have to be or that compulsory element is not mentioned anywhere in the paragraph. Okay, maybe you can test in the first consultation. Okay, so I'm eliminating option C, that is contradictory, or I can say opposite option. So my answer is option B through elimination. So which strategy we are using here? We used elimination method, or I can say elimination strategy. Okay, so that answer is option B, improves precision during radiation. Very good, a lot of correct answers. Yes, Jinu, Reba, Reshma, it is option B. Then now tell me, where did you get that option B from? Improves precision during radiation. Okay, so as you guys know, part B and C, it's all about what? Paraphrasing. So what is paraphrasing? Which means they will definitely give you the direct sentence from the paragraph into your answer option, but still it will not be the correct answer. Why? Because part B and part C is all about paraphrasing. So what is paraphrasing? Which means the same meaning will be there, but entirely different sentence structure. Okay, the sentence structure will be entirely different. Yeah. So instead of improves, increases, precision, accuracy during the radiation. So where is it mentioned? See, the last lines, depending on the area of the body to be treated, personalized equipment such as, so that is a keyword from the question, equipment for radiation therapy. Face mask may be used to stabilize, okay, increase, improves patient's position. Then this equipment helps keep the patient comfortable and still during the treatment, which means during that radiation. Clear? So that is the correct answer and makes the treatment more accurate, improves precision during radiation. So that is the correct answer. I hope it is clear, right? Any doubts in that question? So if you have any doubts related to the question, you can comment it here. Okay, all right. So now it's time for part A. So we are moving to a new material. Okay, so before moving to the new material, let me discuss something regarding part A. Okay, so yes, the material is here. So this is the material, pancreas transplant. Okay, so here is the material. Then tell me, what do you know about part A? Why part A is important? So in each and every live session, we will discuss about part A for sure. So what is the importance of doing part A? So we have, as you know, we have only 15 minutes for doing part A. Okay, so within this stipulated period of time, it is difficult for us to do part A. Is it possible for us to complete part A within 15 minutes? Is it possible? Is it possible, Reba, Reshma, Jinsi? Is it possible? So can you finish part A within 15 minutes? Yes. Okay, the answer is, of course, yes. So we can finish part A within 15 minutes. Actually, if you are a student who can do part A within 8 minutes, that indicates you guys are practicing part A really well. Okay, which means in summary, we will take or we can take maximum 8 minutes for the completion of part A. Okay, that's enough. So how? Through continuous practice. Okay, so for that you can do additional materials daily. Okay, so please attend the live sessions daily. It will help you to improve your reading habit. I can say yes, reading habit, the module itself. Okay, so coming back to part A. So yes, I'm starting with the timing. Okay, already I've told you regarding the time. It is 15 minutes. Then coming to the question. Okay, number of questions. So what about the number of questions? Okay, Reshma, very good. You have a clear understanding regarding part A. 20 questions within 15 minutes. Skimming and scanning method. Very good, dear. Okay, so that's all about 20 questions we have, 15 minutes. And the strategy we are using here, it's all about skimming and scanning. Okay, so skimming and scanning, which means skimming, it is fast reading, speed reading. Whereas scanning, which means we are searching for some important keywords from the text. Okay, so as you can see here, see, we have 4 different texts. Okay, in part A, we have 4 different texts. Each of the texts will be different from one another. Okay, and one among them will be a pictorial. See, text D is all about the pictorial. This is a table, a chart. Okay, so maybe a table will be given, a chart, okay, a diagram will be there. So one of the texts will be a pictorial. Then, for example, if the text A, I can say that the topic is pancreas transplant. A procedure is mentioned. Okay, so maybe a disease condition, maybe a procedure, a method. So it will different according to the material. So here, text A will be, okay, based on this particular, what is this procedure? Why we are doing this procedure? Okay, so this is all about this explanation or the description of this particular procedure. And when you come to part B, it's all about, see, the detailed explanation of the procedure, how the surgeons are doing this procedure. Okay, what are the factors affecting it? And when you come to part C, it's all about the complications, risk factors regarding the procedure. Okay, finally, when you come to text D, it's all about the management. Clear? So that's all about pancreas transplant. So, then I'm coming back to skimming and scanning method. I've told you regarding skimming, which means fast reading, and scanning, which means what? Searching for some important words. Yes, Nijo, hi dear, how are you? Okay, so, yes. So then how will you mark some keywords from the text? Okay, so it's very important to mark some keywords from each of the text. Okay, so first of all, I'll read this text, then we will underline what are the important keywords. Clear? Okay, so from text a pancreas transplant is a surgical procedure to place a healthy pancreas from a deceased donor into a person whose pancreas no longer functions properly. So from the first sentence, I'm marking pancreas transplant, then procedure, then I'm marking functions. So these are my keywords from the first sentence. Then the pancreas is an organ that lies behind the lower part of the stomach. One of its main functions is to make insulin, a hormone that regulates the absorption of sugar into cells. So from the second sentence, I'm marking some keywords like pancreas, then stomach, okay, again functions, insulin, hormone, absorption. So these are my, as well as cells, okay. So these are my keywords from second sentence. Then if the pancreas doesn't make enough insulin, blood sugar levels can rise to unhealthy levels, resulting in type 1 diabetes. So my keyword from the third one is insulin, then type 1 diabetes. Okay, then the last one. Most pancreas transplants are done to treat type 1 diabetes. So my keywords: treat type 1 diabetes. A pancreas transplant offers a potential cure for this condition, for it's typically reserved for those with serious complications of diabetes, because the side effects of a pancreas transplant can be significant. So these are my keywords from text A. Okay, so why these are my keywords from text A? Then I'll give you this clue. So when you read each and every text, you can mark all the headings. Okay, if the headings are mentioned, you can mark all the headings from each of the text. Then if subheadings mentioned, mark the subheadings. Okay, if numbers mentioned, for example, see type 1 diabetes, the 1 is a number, so I have just marked 1. So likewise, you can mark all the numbers from each of the text. Okay, then the fourth one, signs and symbols. I haven't found any signs and symbols here, so yeah, of course not. Okay, fifth one, names, all the names, maybe name of a person, name of a disease condition, name of a country, name of an equipment, whatever pronouns they have mentioned here, you can mark all the pronouns. Okay, then sixth one, abbreviations. So what do you mean by abbreviation? As you guys know, okay, it's short forms. Any short forms here? Did you guys see any short forms here? No. So if it is mentioned in the paragraph or in the text, you can mark all the short forms, abbreviations. Then comes the italicized or bold letters. Okay, so any italicized or bold words here? No. Okay, I haven't found anything related to italicized or bold words. Then eighth one, all the brackets. See any brackets here? No. Okay, then ninth one, the words that indicate time. For example, when, now, previously, currently, during, after, before. Okay, so I haven't seen anything related to time here. Then the 10th one is the words that indicate experiment related words. So I have found some experiment related words here: procedure, absorption. Okay, so these are the words which I found related to experiment. Then the words which are related to research, so complications, functions. Okay, so these are the words that are related to research. Then you can give special attention to the first and last line of each and every paragraph, as well as all the bullet points. So these are my 13 keyword strategy to clear part A. Okay, hope it is clear for you, right? Okay, so let me know in the comment what are your keywords from the rest of the text. Okay, so text B, procedure. So I'm marking. Okay, so I'm marking procedure. Then surgeons perform pancreas transplants with general anesthesia. So you are unconscious during the procedure. Then the anesthesiologist or the anesthetist gives you medication as a gas to breathe through a mask or injects a liquid medication into a vein. After you are unconscious, what are the next factors that are influencing? So the an incision is made down the center of your abdomen. The surgeon places donor pancreas and a small portion of the donor's small intestine into your lower abdomen. The donor intestine is attached to either your small intestine or your bladder, and the donor pancreas is connected to blood vessels that also supply blood to your legs. Your own pancreas is typically left in place to aid digestion. Then if you're also receiving a kidney transplant, the blood vessels of the new kidney will be attached to blood vessels in the lower part of your abdomen. Okay, the new kidney's ureter, the tube that links the kidney to the bladder, will be connected to your bladder unless your own kidneys are causing complications such as high blood pressure or infection. They are left in place. Then pancreas transplant surgery usually lasts about 3 to 6 hours depending on whether you are having a pancreas transplant alone or kidney and pancreas transplants at the same time. Okay, so clear? So these are my keywords from text B. So now I am moving to text C. So here what are the keywords? Okay, Reshma. Surgeon, anesthetist, incision, lower abdomen, 3 to 6 hours. Okay, fine. Very good. Okay. And what about text C? What are your keywords from text C? Donor intestine, donor pancreas. Okay, very good. Okay. Then complications of the procedure. So my keywords: complications, procedure. Pancreas transplant surgery carries a risk of significant complications including blood clots. So I'm just reading those bullet points, okay? Even though it is not bullet points, we can consider it as bullet points. So blood clots, bleeding, infection, excess sugar in the blood, urinary complications, failure, rejection, anti-rejection. Then after a pancreas transplant, you will take medications for the rest of your life to help prevent your body from rejecting the donor pancreas. Then these anti-rejection medications can cause a variety of side effects including, so what are the next set of bullet points? Bone thinning, high cholesterol, high blood pressure, nausea, sensitivity, other side effects, puffiness, weight gain, swollen gums, then acne, excessive hair growth or hair loss. Anti-rejection drugs work by suppressing your immune system. These drugs also make it harder for your body to defend itself against infection and disease. So these are my keywords from text C. Okay, Reshma, complication of the procedure. Okay, Reba, yes, anti-rejection medication, side effects. Very good, excellent. Then text D. So this is all about a pictorial. So what are the important things here? Insulin dependent diabetes mellitus. So the condition itself is very important. And what are the next procedures? Severe metabolic complications, then hypoglycemia, then ketoacidosis, marked hypoglycemia. Okay. Then what are the next thing? Insulin based management to prevent acute complications. So acute, then PTA, the short form, pancreas islet transplantation, SPK transplant, which is related to the diabetes, then PAC transplant, liver donor kidney transplant, then less than, the signs and symbols, less than 1 year, it is greater than 1 year, then less than 1 year here. Okay, all the signs and symbols from here. Okay, so these are my keywords from text D as well. Okay, so now we are moving to the first set of questions. Okay, so that's the first one. So these 20 questions can be categorized into 3 different sets. Okay, so the first 1 to 7 set of questions that can be called what? Match the following. Okay, so we are locating that particular answer from the text. So that is match the following. And 8 to 14, which can be called short answer questions. Okay, so the first one is match the following, and second one short answer questions, and the final one which comes to fill in the blanks. Okay, so yes, so the first question. The components that ascertain the prolongation of pancreas transplant. So my keywords from the question is components, factors, ascertain, identify, determine, prolongation, the duration of pancreas transplant. So what are the factors that affects pancreas transplant? So I got that answer from which text? Okay, so there are a lot of factors including this pancreas transplant surgery. Okay, so what are they? Complications of the, sorry, it's not from complications. Okay, yeah, it is from the procedure. Yes. So what are the factors affecting it? So these are the different factors affecting the procedure. So I got that from text B. Okay, so my answer is B. Okay, Joycey, B, Reba, yes. Okay, Reshma, it's not from text C, dear. Actually, it is from text B. Okay, they are not asking you regarding the management, which means the factors, the components affecting the transplantation, which means simply I can say why we are doing the procedure. Okay, or that factors affecting the procedure, components. So which means it is from text B. Yes, please. Okay, then the second one. When do we direct SPK transplant? When do we conduct? Direct, which means conduct SPK transplant. Okay, so where is it mentioned? When do we conduct SPK transplant? Any idea? Second one. Okay, text D. Okay. What about you, Reshma? Second question. Text D. Okay, Joycey. When do we conduct SPK transplant? Text D. Okay. Is that text D? Sure. Is that text D? So what do you mean by SPK transplant? Any idea? What is SPK transplant? Okay, Anita, Reshma, okay, it is text D, right? Okay. So my keywords from the question, when, direct or conduct, then transplant. So these are my keywords from the question. Okay, so according to you guys, you have told me that it is from text D because you have noted that particular word SPK, right? And it is mentioned here. So that is why you guys are saying it is from text D, right? Okay, so what is the question? When? So no suitable living donor or expected time on dialysis less than 1 year. So where they have mentioned about when it is conducted? Okay, so one thing is for sure, SPK is okay, I agree. But what about that time when it is conducted, when it is direct? Okay, so I'm not agreeing with your answers, I'm very sorry. I got that answer from text A. SPK is not mentioned anywhere in the para, but still it is connected to insulin dependent diabetes mellitus. So if your sugar level is too high, there is a chance that you will get type 1 diabetes mellitus. Okay, so see the last paragraph. Most pancreas transplants are done to treat type 1 diabetes. A pancreas transplant offers a potential cure for this condition, but it's typically reserved for those with serious complications of diabetes because the side effects of the pancreas transplant can be significant. So why you are doing this transplantation? Okay, because your sugar level is too high. So when will you conduct it? If the chance or if in the state of diabetes, type 1 diabetes mellitus. So my answer is from text A. Okay, so my answer is A. Third one, why do we place urine pancreas in the scene of surgery? So my keywords, place, then R, and as well as pancreas. So these are my keywords, place, R on pancreas. Okay, any idea? Third one, why do we place R on pancreas in the scene of surgery? So that is the third question. Okay, so again it is all about the procedure, I guess. And I got that answer from here. See, urine pancreas. So those are the keywords, right? Urine pancreas is typically left in place to help digestion. Okay, so my answer is B. Okay, so answer is B. Yeah. Then fourth one. What about the fourth one? Okay, Riba, very good. It is from text B. So what about fourth one, dear? What maladies are generally treated with pancreas transplant? So what maladies? Okay, so what are the complications? What are the maladies mentioned here? Complications. See, most pancreas transplants are done to treat type 1 diabetes. Again, it is from text A. The complications, serious complications, maladies mentioned, okay, of diabetes. So answer is from text A. Okay, so that is from text A. What complications, serious complications, maladies are generally treated with pancreas transplant? So it is from, again, text A. Okay, then the fifth one. What all factors must be endure? Endure, which means we have two meanings. Endure, which means suffer. Okay, that is the first meaning. And another meaning is that exists. So here, which means exist. Okay, so what all factors must be exist suitable to conduct pack transplant? So my keywords: factors, endure, and pack. Okay, so what are the factors connected to that pack transplant? Okay, so as you can see here from text D in the management, so what are the factors connected to that? Suitable living donor plus expected time on dialysis, which is greater than 1 year, living donor kidney transplant, and you can go for a pack transplant. So these are the factors connected to that. So my answer is from text D. Okay, very good. It is from text D. Then sixth one. The familiar ramifications, okay, the familiar ramifications of anti-rejection drugs. So my keywords: familiar ramifications and anti-rejection. Okay, so where they've mentioned about this anti-rejection drugs. Okay, the side ramification, which means the complication, side effects of this particular medicine. Okay, so that is all about the complications. And see, anti-rejection medication side effects, which means the ramification. Okay, so that is from C. So my answer is from C. Then the last one from the first set of questions, the major urinary hurdles, which means the complications, again the problems, correlated with pancreas transplant. So my keywords: urinary hurdles correlated. Okay, again I know that the complications mentioned in text C, I am looking into the urinary complications. So where is it mentioned? Yes, urinary complications including leaking or urinary tract infections. So I got it from text C. Okay, so these are the answers. Clear? Okay, so now we are moving to the second set of questions, which is 8 to 14 short answer. Okay, so what about first? Okay, Mega, you got 6 out of 7. Okay. Oh, that's good. Okay, then 8th one. Name the approach employed to treat ketoacidosis apart from pancreas transplant. Okay, so my keywords: approach, then ketoacidosis, as well as employed. Okay, so these are my keywords: approach, employed, ketoacidosis. Okay, Joycey, you got 5. Okay, so this is a little bit tough material, I know that, and it is confusing. Okay, yeah, so name the procedure or name the approach used, employed to treat ketoacidosis apart from pancreas transplant. So what is the procedure called? Okay, so that procedure called, it is PTA. Okay, so answer should be PTA from text D. It is a very simple answer, PTA. Okay, so the next one, 9th one. Who gets restrained from the mechanism of anti-rejection drugs? So my keywords: restrained, mechanism, anti-rejection. So I know anti-rejection, which is mentioned in text C. Okay, so what is your answer? See the last paragraph. Anti-rejection drugs work by suppressing. So suppressing, which means what is the synonym mentioned there? Okay, restrained, suppressing your immune system. So my answer is immune system from text C. Clear? Okay, so 10th one. The part where the inceptive amputation is made to conduct pancreas transplant. This is a little bit tough question because we know the part. Inceptive amputation. Okay, as well as made to conduct pancreas transplant. So my keywords: inceptive, amputation, conducts. Okay, so that is the 10th question. So what is your answer? Okay, so that procedure, I think. Yeah, so here they have mentioned about the incision, inceptive incision. An incision is made down the center of your abdomen. So my answer is center of your abdomen. So you don't have to write that you're there. Your answer should be center of abdomen. Very good, Reshma. Yes, center of abdomen should be the correct answer. Okay, very good. Then 11th one, which condition can be advanced following the unhealthy upsurge increase in sugar levels? Okay, so condition, then advanced, upsurge. Okay, so which is the condition which is mentioned in text A, and what about that condition mentioned? Okay, so if the pancreas does not make enough insulin, blood sugar levels can rise, upsurge, that is my keyword, to unhealthy levels resulting in type 1 diabetes. So my answer should be type 1 diabetes from text A. Understood? Okay, so now this next one, 12th one, a little part of what else is placed along with the donor pancreas into the lower abdomen. So my keywords, part, then along, as well as lower. Okay, so what is the correct answer here? 12th one, any idea? 12th one, yes, answer should be small intestine, because donor is already mentioned in the question, so that you can write small intestine. That is from text B in the procedure. Okay, so the surgeon places the donor pancreas and a small portion of the donor's small intestine into your lower abdomen. So answer should be small intestine. Okay, then yeah, 13th one, name the hormone produced by pancreas that synchronize the assimilation of sugar into cells. So my keywords, hormone, synchronize, assimilation. Okay, so what do you mean by assimilation? An idea? What is assimilation? So it is from text A. Okay, so what is mentioned here regarding the assimilation? Assimilation, which means the absorption. Okay, so answer should be insulin. So why it is insulin? Pancreas is an organ that lies behind the lower part of the stomach. One of its main functions is to make insulin, and that is a hormone. So the question is all about what hormone? Answer should be insulin, that regulates, okay, absorption, assimilation of sugar into cells. Then the last one, a kind of medicine used by the beneficiary for the rest of their life to help prevent their body from rejecting the donor pancreas. So what is the correct answer here? Okay, Gina, insulin, Reba, very good. It is insulin, yes. What about 14th one? Okay, so that is a kind of medicine. I know that medicine is mentioned in text C. So that kind of medicine is, okay, anti-rejection medication. So answer should be anti-rejection. Yes, very good. Anti-rejection. Okay, so which is from text C. Anti-rejection medications can cause a variety of side effects. Okay, so answer is anti-rejection. So that's all about 14 questions. So now it's fill in the blanks. 15th one. Dash is typically reserved for those with serious complications of diabetes because the side effects of pancreas transplant can be significant. So my keywords, reserved, then serious complications. Okay, so where is serious complications mentioned? And as you guys know, serious complications mentioned in text A. Okay, so what is the serious complication mentioned? Yes, see. But it is typically, the keyword, reserved for those with serious complications of diabetes because the side effects of a pancreas transplant can be significant. So answer should be pancreas transplant from text A. Okay, 16th one. Pancreas transplant surgery usually lasts about dash depending on whether you are having a pancreas transplant alone or with other transplant. Okay, so what is the correct answer here? Last about, which means they need the time, usually last, the duration. Okay, so answer should be, what is the correct answer? It should be from text B. Okay, Riba, it is 3 to 6 years. Okay. Okay, 3 to 6, not years, hours. 3 to 6 hours should be the correct answer, of course. And next one, 17th, if the patient is also receiving a dash, the blood vessels of the new kidney will be attached to the blood vessels in the lower part of your abdomen. Okay, so my keywords, receiving, then new kidney, then abdomen. Okay, so what is the correct answer here? Any idea? 17th one. What about 17th one? Okay, any idea? 17th question. Okay, so again it is all about the procedure. So if you are also receiving a kidney transplant, the blood vessels of the new kidney will be attached to blood vessels in the lower part of your abdomen. So what are the keywords here? Okay, so what are the keywords which I've already marked? So my keywords were blood vessels as well as abdomen. Okay, new kidney. So my answer is kidney transplant. Okay, then 18th one, the insufficient making of insulin by pancreas leads to the unhealthy rise in dash levels, lead to type 1 diabetes. So what about this one? 18th one. Okay, what can lead to? What rise can lead to? If there is a rise in blood sugar. Okay, blood sugar levels can rise. So my answer is blood sugar from text A. Direct answers. Okay. Then 19th one, anti-rejection drugs also make it harder for your body to defend itself against dash and disease. So my answer is anti-rejection. That is the keyword. So which is from text C. Okay, and I got the answer from the last line, against infection. My answer is infection. Very good, Joycey. Gopika, yes, it is infection. Okay. Okay, mega infection. Very good. Okay, Reshma, yes, into mega. Yes, it is infection. Then what about the last one, 20? Question number 20. Failure to insulin based management to prevent dash are then managed through PTA or pancreas as let transplantation. Okay, so what is the correct answer here? Very good. Answer is from text D and it should be acute complications. Very good. Okay, so answer is acute complications. Okay, Mega, Joycey, Reba, it is acute complications. So that is all about part A. So may I know in the comments how many of you got 20 out of 20? Anyone with 20 out of 20? Okay, I know that it may not be possible because it was a little bit tough material, I know. So anyone with 19 or 18? Okay, 19, 18, 17. All right. Okay, so, okay, Joycey, you got 17. Congratulations. Very good, dear. Okay. All right. So, that's all about today. Okay. So, I'll meet you guys tomorrow the same time, 2:30. Okay, afternoon, 2:30 p.m. So, God bless you all. Take care. Thank you.